Did you know that by the age of 60, about half of all men experience some form of prostate-related health issue? While it's a common concern, the silence around this topic often leaves many feeling uncertain and alone. But what if we told you that understanding your prostate health could unlock answers to symptoms you might have thought were just part of getting older? Let's consider Tom, a 68-year-old retired teacher. For months, Tom noticed he was waking up multiple times at night to use the bathroom. It left him tired, frustrated, and wondering if he was doing something wrong. Sound familiar? If you've ever dealt with changes in urinary habits, discomfort, or other symptoms, but hesitated to ask questions, you're not alone. Prostate issues can feel like a sensitive topic, but they don't have to be. Whether it's benign prostatic hyperplasia BPH, prostatitis, or even prostate cancer, there are ways to manage, treat, and most importantly, understand these conditions. And the first step is having a conversation about what's happening and why. This video is here to help. Together, we'll explore the key signs and symptoms of common prostate issues, what they mean, and how you can take simple, empowering steps to care for your health. By the end, you'll not only feel more informed, but also ready to have that important conversation with your doctor, or even with a loved one. So, let's dive in and demystify this important aspect of men's health. After all, knowledge is the best tool for staying proactive and confident. Are you ready? The prostate is a small gland, about the size of a walnut, located just below the bladder and in front of the rectum. Despite its small size, it plays a big role in men's health, particularly in reproductive functions. The prostate produces some of the fluid that makes up semen, helping to nourish and protect sperm. As men age, however, this seemingly minor organ can become the center of some major health concerns. One of the most common issues is benign prostatic hyperplasia BPH, or an enlarged prostate. As the prostate grows, something that naturally happens with age, it can press against the urethra, the tube that carries urine out of the body. This can lead to frustrating symptoms like frequent urination, difficulty starting and stopping the flow, or even a weak stream. These symptoms often occur at night, disrupting sleep and leaving you feeling drained during the day. Then there's prostatitis, which is inflammation of the prostate. This condition can result from bacterial infections or other causes and often brings discomfort, pain during urination, and even flu-like symptoms. Prostatitis can occur at any age, but it's more common in younger and middle-aged men. Finally, there's prostate cancer, which is one of the most diagnosed cancers among men. The good news is that when caught early, prostate cancer is often highly treatable. Regular screenings, including PSA prostate-specific antigen tests, can make a significant difference in early detection. Let's talk about Paul, a 64-year-old grandfather who started noticing some changes, frequent trips to the bathroom, discomfort while sitting for long periods, and even occasional pain. For months, Paul brushed these symptoms off as a normal part of aging. But after some gentle nudging from his wife, he finally went to see his doctor. Paul learned that he had an enlarged prostate, a condition affecting roughly half of men over 50. With his doctor's guidance, Paul started making small lifestyle changes, like drinking less caffeine and avoiding fluids before bedtime, which helped reduce his nighttime trips to the bathroom. His doctor also prescribed medication to relax the muscles around his prostate, improving his urinary flow and comfort. It's important to remember that while these issues are common, they're not inevitable. and they're certainly not something you have to endure in silence. By understanding your body and paying attention to changes, you can take charge of your health and find solutions that work for you. Now, take a moment to think. Have you noticed any subtle changes in your urinary habits or comfort lately? It's not always easy to talk about, but starting the conversation with your doctor or a trusted person can open the door to better health and peace of mind. When it comes to prostate health, early detection is your best ally. Many prostate-related issues, including serious ones like prostate cancer, start quietly. There may be no noticeable symptoms at first, but over time, these conditions can grow more serious and harder to treat. That's why routine screenings are so essential. They catch problems before they become overwhelming. One of the most common tools for monitoring prostate health is the PSA test. This simple blood test measures the levels of prostate-specific antigen, a protein produced by the prostate gland. Elevated PSA levels can indicate prostate enlargement, inflammation, or even cancer. While an elevated PSA doesn't always mean something is wrong, it's a good reason to explore further. The other key test is the digital rectal exam DRE. While it might sound uncomfortable, it's a quick and straightforward procedure where a doctor checks the prostate for any abnormalities in size, shape, or texture. Take the story of James, a 72-year-old retiree and avid golfer. James always felt healthy and rarely went to the doctor. However, during a routine checkup, his physician suggested a PSA test based on his age. At first, James hesitated. After all, he felt fine. But he ultimately agreed. When the results came back, his PSA levels were slightly elevated. This led to a follow-up exam and a biopsy, which revealed early-stage prostate cancer. Thanks to early detection, James was able to undergo a less invasive treatment and continue enjoying his golf games without major disruptions to his life. Screenings might feel unnecessary if you're symptom-free, but they're a powerful way to stay ahead of potential problems. The key is finding a screening schedule that works for you. For most men, doctors recommend starting annual PSA tests and DREs at age 50. However, if you have a family history of prostate cancer or are part of a higher risk group, like African American men, it might be wise to start earlier, around age 40 or 45. It's also worth noting that screening guidelines vary, and every individual is different. That's why it's so important to have an open and ongoing dialogue with your doctor about your prostate health. They'll help you weigh the benefits and potential drawbacks of screenings and decide what's best for you. Let's not forget the importance of self-advocacy. If you notice symptoms like difficulty urinating, blood in your urine, or persistent pain in your lower back or pelvis, don't wait for your next routine checkup. Reach out to your healthcare provider right away. These signs don't always mean something serious, but they deserve attention. Pause for a moment and reflect. When was the last time you had a conversation with your doctor about your prostate health? If it's been a while, or if you've never brought it up, consider making it a priority at your next visit. Small steps like these can lead to big improvements in your overall well-being. If there's one piece of advice that can't be emphasized enough, it's this. Staying proactive about your health is one of the most empowering things you can do. Regular checkups and early detection are vital in managing prostate health effectively. While it might feel uncomfortable or even unnecessary to address prostate issues when you're feeling fine, prevention and early action can save you from complications down the road. Let's consider the story of Frank. At 72, Frank had always prided himself on his robust health and active lifestyle. He wasn't one to visit the doctor unless something felt seriously wrong. But during a routine physical, his doctor suggested a prostate-specific antigen PSA test, a simple blood test that can help identify prostate problems early. Reluctantly, Frank agreed, and the results showed elevated PSA levels. It was the first indication of a potential issue, and because it was caught early, Frank could explore treatment options that fit his lifestyle without any major disruptions. What does a typical prostate screening look like? It usually involves a combination of a PSA test and a digital rectal exam tray. While these may sound intimidating, they are quick, straightforward, and highly informative. PSA levels can provide clues about inflammation, enlargement, or other concerns, while the tray offers a hands-on assessment of the prostate's condition. When performed regularly, these tests provide valuable insights that allow for timely interventions. If the thought of these tests makes you feel uneasy, you're not alone. Many seniors hesitate to undergo screenings out of fear or discomfort. But here's something to consider. These tests aren't just about detecting serious conditions like prostate cancer. They're also about gaining peace of mind, staying informed, and taking control of your health journey. Early detection often leads to simpler, less invasive treatments and better outcomes overall. And it's not just about the physical benefits. There's emotional reassurance in knowing you're doing everything you can to prioritize your health. Think about Paul, a retired firefighter, who initially avoided prostate screenings because he didn't want to know if something was wrong. But after attending a health seminar at his community center, he realized that being proactive wasn't about expecting the worst. It was about empowering himself with knowledge. When Paul finally scheduled his screening, he left the doctor's office feeling a newfound sense of control over his well-being. Let's take a moment to reflect. When was the last time you had a comprehensive checkup, including a conversation about prostate health? Scheduling a visit with your doctor might feel like a small step, but it's one of the most impactful actions you can take to ensure a healthier future. Now that we've explored the importance of screenings, let's move on to how lifestyle adjustments and support systems can complement these efforts to enhance your overall well-being. Let's take a step toward empowerment. For seniors navigating prostate issues, lifestyle changes can have a significant impact on your well-being and comfort. It's not about overhauling your entire routine, but about making small, intentional shifts that add up to big benefits over time. Take exercise, for instance. Regular, moderate physical activity can do wonders for your overall health, including prostate health. You don't need to train for a marathon. Simple activities like walking, swimming, or gentle yoga can improve circulation, reduce inflammation, and even help with urinary symptoms associated with prostate conditions. Picture Harold, a retired teacher who felt constrained by his prostate enlargement. By committing to a daily 15-minute walk around his neighborhood, he noticed not only an improvement in his symptoms, but also a boost in his mood. It's a gentle reminder that every step counts. Nutrition plays an equally vital role. Diets rich in fruits, vegetables, and whole grains can promote prostate health, while reducing processed foods and red meat may lower risks of complications. Foods like tomatoes, broccoli, and green tea are packed with nutrients that are believed to support prostate function. Alice, a widower who loved her morning tea, swapped her regular black tea for green tea after reading about its potential benefits. Over time, she found the change soothing and felt reassured that her small effort might be making a positive impact. But lifestyle isn't just about exercise and diet. It's also about mental and emotional well-being. Stress can exacerbate many health conditions, including prostate-related ones. Deep breathing, mindfulness, or even picking up a relaxing hobby can help manage stress levels. Janet, a retired artist, took up watercolor painting when her husband began experiencing prostate symptoms. Not only did it provide her with a creative outlet, but it also became a shared activity that brought them closer together. Beyond individual habits, the importance of a support system cannot be overstated. Whether it's leaning on family, confiding in close friends, or joining a local or online support group, knowing you're not alone makes a world of difference. Support groups, in particular, can offer a safe space to share experiences, seek advice, and find encouragement. Consider Walter, who discovered an online community for men with similar challenges. Sharing stories and tips with others gave him a sense of solidarity and hope, transforming his approach to managing his condition. Here's a moment to reflect. What's one small lifestyle change or connection you could make today to support your prostate health and overall wellness? Remember, every step, no matter how small, brings you closer to a healthier, more vibrant life. Let's explore one last crucial insight together: how to navigate treatment options and embrace hope for the future. Prostate health isn't just about doctor visits and screenings. It's also about the choices you make every day. Lifestyle adjustments play a powerful role in preventing and managing prostate issues. From the foods you eat to the way you move your body, even small, consistent changes can make a world of difference. Take diet, for example. Research shows that a diet rich in fruits, vegetables, whole grains, and lean proteins can support prostate health. Specifically, foods high in antioxidants, like tomatoes, broccoli, and green tea, are believed to help reduce inflammation and promote overall well-being. Omega-3 fatty acids, found in fatty fish like salmon, can also provide anti-inflammatory benefits. Imagine this: a colorful plate filled with grilled salmon, steamed broccoli, and a fresh side of berries. Not only is it delicious, but it's also a meal that nourishes your body and supports your prostate health. Then there's the impact of physical activity. Regular exercise not only keeps your weight in check, but also improves circulation and reduces inflammation, both of which are beneficial for prostate health. Gentle activities like walking, swimming, or yoga can be particularly effective. Consider the story of George, a 68-year-old retiree who began experiencing frequent nighttime urination, a common symptom of prostate enlargement. After his doctor recommended more physical activity, George started a simple morning walking routine. Within a few months, he noticed significant improvements in his symptoms and his overall energy levels. Stress management is another crucial piece of the puzzle. Chronic stress can exacerbate inflammation and contribute to hormonal imbalances, potentially impacting prostate health. Incorporating relaxation techniques like meditation, deep breathing exercises, or even spending time on a favorite hobby can have profound benefits. For instance, Richard, an 80-year-old grandfather, found solace in woodworking. He noticed that the more time he spent in his workshop, the less tension he felt, which ultimately helped alleviate some of the discomfort associated with his prostate issues. Staying hydrated is also essential, but with a caveat. While drinking plenty of water throughout the day is crucial for overall health, it's wise to limit fluid intake in the evening to reduce nighttime bathroom trips. Herbal teas like chamomile or peppermint can be soothing alternatives that support relaxation without the caffeine or irritants that might worsen symptoms. Let's not overlook the importance of building a support system. Sharing your experiences with trusted friends, family members, or support groups can provide emotional relief and valuable insights. Sometimes, just knowing you're not alone in your journey can make all the difference. For example, Harold joined a local men's health group where he learned practical tips from others facing similar challenges. The camaraderie and shared knowledge became a cornerstone of his prostate health journey. Reflect for a moment, what lifestyle changes could you make today to support your prostate health? Could it be adding more colorful vegetables to your meals, committing to a daily walk, or finding time for a stress-relieving activity? These small, consistent actions can help you feel empowered and proactive. As we approach the conclusion, let's tie all these insights together and explore how they can inspire you to take charge of your prostate health journey with confidence and hope. As we wrap up our journey through understanding and managing prostate issues, take a moment to acknowledge how far you've come just by being here and learning these insights. You've learned how the prostate works, why conditions like BPH prostatitis and even prostate cancer deserve your attention, and how routine screenings like the PSA test and digital rectal exam can catch problems early when they're most treatable. You've seen how small lifestyle shifts, adding a daily walk, choosing more colorful fruits and vegetables, managing stress with hobbies or deep breathing exercises, can ease symptoms and boost your overall health. And you've heard real stories from men like Tom, Paul, and George who found relief through simple diet changes, exercise routines, and open conversations with their doctors. Their journeys remind us that you aren't alone, and that hope often lies in taking one small step at a time. Perhaps most importantly, you've discovered the power of community and communication. Talking openly with your partner, confiding in friends or support groups, and collaborating with your healthcare team can transform worry into confidence. Whether it's arranging a check-in with your doctor, setting intentions to drink a bit less fluid before bedtime, or picking up a new stress relief hobby, these actions reinforce that you're in the driver's seat of your health. So, what will you do first? Maybe it's scheduling that overdue prostate screening. Maybe it's swapping your afternoon snack for a handful of nuts and berries. Or perhaps it's simply sharing what you've learned today with a friend who could benefit too. If this video has given you practical ideas and the encouragement to act, please subscribe to The Elder Voice, your source for simple, research-backed tips on living your healthiest, happiest life after 60. Hit the bell icon so you never miss a new video, and leave a comment below sharing the one change you're most eager to try. Your story could inspire someone else to take that crucial first step. Thank you for watching and for committing to your well-being. Here's to stronger health, deeper connections, and the confidence that comes from knowing you're doing the best for yourself at every age.